Good morning, everyone. Thank you for this wonderful opportunity for me to present presentation regarding artificial intelligence in healthcare. To be in a part of international multidisciplinary conference. Theme of this conference is effect of technological revolution in academic field of science and humanities. My sincere thanks to Dr. Mukesh Gupta sir, Chairman, Future Group of Institution, Chief Partner, and also my sincere thanks to Dr. KPS Chauhan sir, Convener, and Co-Convener Dr. Shukla sir. Now we'll move on to the topic. Before the topic, I will introduce myself. Myself, VENDRAN, working as a clinical coordinator in MSC Dubai Hospital. So my topic is artificial intelligence in healthcare. The next subtopic is outline of artificial intelligence. So in that we will see history of artificial intelligence, domains of artificial intelligence, what is artificial intelligence, stages of artificial intelligence, applications of artificial intelligence in healthcare, artificial intelligence in nursing. We will see history of artificial intelligence. So in 1950, they started a big computer for the purpose of inputting the information in a binary manner. So by that information they started to analyzing. In 1951 they started to do the artificial intelligence little bit upgraded in games. In 1956 and 59 they started to do this artificial intelligence in research. In 1960 this artificial intelligence, what they did, they planted in the robotics by giving instruction and getting the work done by the robots. In 1961 they developed the artificial intelligence up to the intelligence of human. In 1961 to 2011 they upgraded in various fields like gaming, giving a competition between human brains and the artificial intelligence via chess, or in 2000 they started to using the artificial in various fields such as traffic rules and Google Maps. In healthcare they started using the laboratories, research, and they are started using in the by collecting the data from the patients, like that they started to use. So these are the history of artificial intelligence. Next we will move on to the domains of artificial intelligence. What are the domains of artificial intelligence? There are 6 domains of artificial intelligence: machine learning, deep learning, robotics, expert system, physiologic, and natural language. Why we have to talk about artificial intelligence now? What is the necessity needed for we need to talk about artificial intelligence now? So the need for artificial intelligence to do more computation power or functions. The next one, to do or to storage large number of datas, more datas abundantly, and go for the better algorithmic functions. And the last one, for better or broad investments. So since the AI is new platform, so the investment will be larger and wider. The spectrum of investment will be widened. John McCarthy first coined the term artificial intelligence in 1956. So generally artificial intelligence, it is a science and engineering of making intelligent machines. So in a simple word, it is a science and engineering of making intelligent machines. Next we will move on to the how the AI can be defined. Artificial intelligence can be defined with the 4 components: decision making, solve complex problems, increase accuracy, perform high level computations. AI also can be defined. Artificial intelligence is development of computer systems that are capable of performing tasks that normally require human intelligence, such as decision making, object detection, solve, solving problem complex, and so on. Solving complex problem and so on. So, four important category it defines the artificial intelligence: decision making, how the human beings are decision making, and object detection, solving complex problem, and so on. So artificial intelligence defines in this four components. Artificial intelligence is development of computer systems that are capable of performing tasks that are normally require human intelligence, such as decision making, object detection, solving complex problem, and so on. Stages of artificial intelligence. So there are three stages of artificial intelligence. Artificial narrow intelligence. Narrow intelligence means it will perform only specific task. So it can be defined as weak AI. The next one, artificial general intelligence. So it is also known as strong AI. In this stage, what it will do, it is the evaluation of artificial intelligence, where the machine will possess what it will do. The machine will do ability to think and make decisions just like humans. That is the stage of artificial general intelligence. Then artificial super intelligence. So in this stage, the computer will have the capability which can overtake the human brains, or which can able to surpass the human beings. Next, applications of artificial intelligence. What are the fields we can use the artificial intelligence? Social media, chatbots, autonomous vehicle. So that is, the vehicle will be driven without the driver. Space exploration, instead of sending the human beings, they will fit the AI and they will send the space shuttle to the space and they will explore the space. And gaming, and banking and finance, agriculture, marketing, healthcare. Next, challenges of AI, challenges faced by Indian healthcare system. So due to this challenges faced by the healthcare system in India, so we need the applications of AI in India. That is the key point in this particular slide. First one, shortage of qualified healthcare and profession and infrastructure. Then affordability. Then reactive approach to essential healthcare, largely due to lack of awareness, access to service, and behavioral factors. Then the patients have traveled to substantial distance for basic and advanced healthcare service. Non-uniform accessibility to healthcare across the country. First, shortage. So in our large country, so we have the shortage in qualified healthcare professionals and also infrastructure, hospital, clinic, PHCs, this facilities related to the healthcare system. Affordability, not every citizen can able to afford the healthcare expense which is sustained in this country. The next one, due to the lack of awareness, so the people can't able to access the service, or they can't able to get the full optimum healthcare. Then the fourth one is, so due to the private facility or concentrated in or around the tier, the patient have to travel. So they have to travel to more distance to get the optimal healthcare service. And throughout the country or throughout the areas, there will be a different healthcare accessibility throughout the country. So if you go for one treatment, the same treatment will not be in the over all the areas in the country. So there will be a different to the same diagnosis, different due to this challenges, we need artificial intelligence. Why do we need AI in healthcare? To save time, energy, money. The next one, to avoid unnecessary walk to the hospital for minor ailments. For example, if you have the artificial intelligence, if you are feeding the information, sending like these are the symptoms, headache, vomiting, like that I am having. So what it will do, it will get the information and it will diagnose and help you for the minor ailments. The next one, to avoid excessive physical burden on the OPD, IPD at tertiary hospitals. So in OPD cases, if they are going for the routine investigation, documentation and everything, so they have to sit for the token and reach out for the doctors, then they go for the pharmacy or they have to get the treatment. So if the AI is having means, so only they have to do the diagnostic findings, giving the blood test, and the findings it will see. According to the findings, it will analyze what type of medication they have to go, what type of treatment they have to undergo. Then to provide specialist based healthcare to the rural population. So most of the rural population villages, they are not able to attain the specialist based care. So to avoid that, if there is a need, if there is AI means, so it will fill the gaps. To avoid misguidance, to provide necessary care to need one. To use e-referral system, connect this peripheral hospital with tertiary level of hospital. So e-referral system means, so if they want, for example, if the patient is going for the clinic and they will be diagnosed so and so, so they can, if they can't provide the minimal or optimal treatment in that level, they can refer the patient to the another hospital with e-referral. Means they have to give the code, just they have to type and it will show all the details. So thereby they can give a startup care to the patient and they will be treated there. So these are the necessities, so the gaps which the AI can be helpful to in filling the healthcare system. Next one, development of AI system. Development of AI tool to address the healthcare challenges is complex process that varies of each tool. So we have to develop different types of tool, either for the OPD and for the ICU ward and for the general ward and for the inpatients and for the surgery or OT. So in different sector in the hospital, each one we have to have different AI tool, that is artificial intelligence tool. Tool might initially developed in a university, then licensed to the another organization and ultimately scaled and deployed by the commercial entity, and user of the tool also vary. First it has to develop and it has to get licensed by licensing authority, then they want to monitor how far this AI tool is works going on. Then after that it will come for the commercial entity in every hospital or sale. So thereby the user can be able to use the various tools. How the product of artificial intelligence develop. Product in the sense here the tools according to each different categories in a healthcare system we want to develop. First one, design and develop, then evolution and validation of that particular tube, then scaling to access the multiple settings, whether the tool is able to accept and use the data from other source, location and more complex challenges. The next one, monitoring and maintenance. After getting the AI system successfully deployed in a hospital or any other clinical setting, it must be continually monitored and maintained. If we are not monitored and maintained means if there is any simple error that can able to diagnose differently, then the harmful will be go for the patients and it will affect total healthcare system. So the product development stages, first we have to design and develop the tool, then evaluation and validation of the tool, then scaling this tool, then monitoring and maintenance after deploying in clinical setting. Next one, principles of artificial intelligence. First, it has to protect the human autonomy. Then, promoting the human well-being and safety and public interest, ensuring transparency, explainability and intelligibility, fostering responsibility and accountability, ensuring inclusiveness and equity, promoting AI that responsive and sustainable. So all these components, the keynote of this component is it has to protect the human well-being, safety and public interest, and also it should have the transparency. Then it has to have the responsibility and accountability. So accountability, responsibility, it should not give the wrong data or any miss data. The next one, ensuring the inclusiveness and equity. So it should be equity and inclusiveness should be there. AI tool in patient care. AI in healthcare has the potential to deliver many benefits. According to the scientific literature, stockhold, including industrial representatives, research, academic researchers, and healthcare providers. So these are the first point. AI has the potential, that is ability to deliver many benefits, which includes, so it can be used as a scientific literature while doing the research project or presentation, or if you need any theoretical knowledge, so that it can be helpful, useful, and stakeholders, and including industrial representatives, so it can recommend the any healthcare industries, or the next it can be available in the academic researcher and healthcare providers. In general, AIL tool augment the gather rather than placing human providers. Studies have demonstrated to improve the results when the AI providers and AI tool work together rather than working independently. The next one, clinical AI tool to augment the patient care. So what are the clinical tools to integrate the patient care? Predicting the health trajectories, recommending treatments, guiding surgical care, monitoring patients, improving medication adherence, recording digital notes. Then automation, laborious tasks. Automation laborious tasks. Predicting health trajectories means, so it can helpful in what are the data it is collected. So collecting the patient data, it can able to find out what is the risk factors. So that is the predicting health trajectories in AI. Machine learning enabled CDS, that is computer data source tool, can help in predicting the likelihood that the patient condition will deteriorating by putting all the data in a computed data source like blood values, BP, heart rate, physiological status and everything. This AI particular machine can helpful for to predict the patient condition, whether the patient will go for further deteriorating, further worsening of their treatment or further worsening condition, it able to predict that. The first example, in 2013-2014, large integrated health system successfully piloted a machine learning model to identify the patient risk. By collecting the data, it can able to transfer what is the patient, normally the values will be up and down. If it is coming down means, so it will predict the patient has to go for intensive care. Other applications in this category include prediction of acute kidney injury and cholesterol define infections. So here we have the studies regarding the health, predicting the health trajectories. So in they have conducted one studies to develop a model for predicting the aseptic shock and identifying the risk of patient before onset conditions. So they have the monitoring all the data and putting in the AI. They find an study, so whether it can able to predict the septic shock. So at specificity of 60%, 67% and sensitivity of 80%, this particular AI tool was able to identify the patient approximately 28 hours before the onset of septic shock. So this particular study, what it did, they have the AI tool, so they input all the patient informations, data, either the blood or investigation, all the investigation, the data form. So what it did does, before 28 hours onset of septic shock, it predicted. Additionally, the model was able to identify the major patients mean of around 7 hours before any sepsis related organ dysfunction, which is in the improvement and routine screening protocols. So what it will do is each 7 hours it able to routinely it will screen the patients and able to predict before the septic shock. So that is the first predicting health trajectories. The next one, recommending treatments. So putting all the patient's values, data, informations, vital signs and everything in a computed data source tool. So what it will do, it can recommend the treatment to the healthcare providers and potentially helping them to make decision more effectively and patient specific. So that is the more important one. What it will do, the particular patient, according to the signs and symptoms, according to the data, it will take the recommended treatments to the healthcare to help them to making the decision. The next one, for example, ventilators can be life-saving. Both prolonged use and premature weaning are associated with the complications, increased mortality rates and high hospital cost. So by deciding whether wean patient receiving the ventilator treatment is an essential aspect of their care. What that AI could do, it will predict successfully whether the patient is weaned from the ventilators or not. So the another study they have been developed regarding AI, a reinforcement learning approach to the weaning mechanical ventilation in an intensive care unit. So the objectives of this study to develop the decision support tool that use the valuable patient information to predict time to when to extubation readiness and to recommend a personalized regimen of sedation dose and ventilator support. So what is the objective? They want to predict the time of extubation when they want to remove that ventilator tube from the trachea. So for that it will give the personalized regimen, sedation dose and ventilator support. So in conclusion, the study shows more promising in recommending the weaning protocols. So with improved outcomes, that means it will minimizing the re-intubation and regulating the physiological stability. That means what are the patients will go for the ventilators. So it will give before according to the data's vital signs and every aspect of the patient's viable or bio data, it will gather and give the analyzing the data and giving the report when to intubate with the sedation amount of dosage and when they need the ventilator support, all those things it will protect. The next, so guiding the surgical care. In the field of surgical care, planning and post-operative care are the most matured application machine learning enabled computer data source tool. Or so what it will do, it will plan in which they have to planning for the post-operative care. Another application include the real-time CDS for surgery and AI enabled surgical robotic are also active areas of research. So both that when they have to operate and the operation can be done by artificial enabled surgical robots So these robotic tool may alert the surgeon when the surgical time is longer than the average. What it will do, it will alert the surgeon, so if the time is prolonging. So they conducted a study, clinical outcome and cost of robotic surgery in prostate cancer. So multi-institutional study in Korea. So objective to compare the surgical function and oncological outcome of a robot assisted laparoscopic radical prostatectomy, laparoscopic radical prostatectomy and retropubic radical prostatectomy. So what they will do, so they will analyze which that the conclusion find the surgical function and outcomes is better with the robot assisted surgery than with the open or laparoscopic surgery. So the better outcome we can find with the AI assisted robotic surgery. So that's the conclusion of this particular study shows. Next, monitoring the patients. So artificial intelligence enables tool can be used to increase availability of health data, including data from EHRSs and variables and other sensors to help monitor the patient in healthcare facilities. Then according to the recent review, the patient monitoring is one of the areas where AI is likely to have greater influence. So where, for example, the provider can use the AI analysis for vital signs, for cardiovascular and respiratory monitoring in ICU. So for example, the patients in the ICU we can monitor by AI tools. So what it will do, the patient will be in the intensive care unit. So all the data will be computed to the artificial intelligence. If there is any prediction or any alert or any notification comes, it will be helpful for the healthcare professional to give the optimum and maximum treatment to the patients, and they will be very cautious in providing care for the patients with this AI enabled tools. So what it will do, it will look all the vital signs, cardiovascular and respiratory monitoring. Thereby it will help, it will be automated defibrillate the patients also. The healthcare facilities also use AI enabled monitoring tool in the hospital. So what it can able to use, they will use the prevention in fall of the patient reduced by giving the burden to the provider or the attender. According to 2015 the reports, the 100,000 hospital patients fall each year. So in each year there will be fall of 100,000 patients. So 30 to 50 of those falls results in injury. So maximum the 50% will result in injuries in the extremities or any bone impermanence to the body. So what this injuries will do, it will do the length and cost of the hospital stay of the patients. So in sometimes this can be leads to the death. So to reduce that, we have to put AI enabled monitoring tool in the hospital to prevent the patient fall. Then one commercial AI tool aiming to help the provider address these issues, use the computer vision, Bluetooth, sensory to analyze the movement, patient room and alertness and alert the care team when a fall is predicted. So this particularly nowadays the advanced bed, that is sensitive outcome monitored bed, which will do the sensitivity of that bed if the patient is lying or if the patient is putting one direction, or if they are falling, chances of falling means it will alert by the beep sound or it will give the notifications. Improving medication adherence. So to address the complaints concerns, the organizations are looking for to create a solution utilizing artificial intelligence and machine learning to increase patient adherence. Some of the solutions that we shown is in the result of this field, including chatbots, smart pills, wristband sensors, gamification apps, smart packaging. So these are the few AI aided tools which can helpful to improve the medication adherence. Recording digital clinical notes. Provider are beginning to use of speech recognition and natural language processing technology for each recording, digital recording notes into the EHR system. So electronical data source system or ERP they can tell, entrepreneur research resource source. So adaptation of EHR system all through it can be reported improve the health care coordination and decision making, has also been associated with the decreased provider satisfaction. The next one, automating laborious task. So what it will do, it will automatically do the difficult task. AI can automate some of the tasks that are simple but labor intensive, allowing the provider more time to spend with the patients. Hospital nurses spend the majority of the times in walking between the patient's room and the nurses stations. So what it will do, by monitoring the patient, they have to walk and go through the near to the patient and check all those things. But if they have the AI program or tool, so they can able to visualize or able to monitor all the vital signs in the one computer box. Surgical nurse has to walk additional miles or while the duty to obtain the supplies and equipments. When you are automated with the AI, means what are the need for the surgery, it will get the tools and it will be providing for the particular surgery. Then distraction and disruption for the non-nursing activities such as gathering and supplying present the risk of patient safety. Many hospitals have already deployed robots for the delivery supplies, among other activities, but they have the limitations. For example, many of the currently deploying supplies delivery robotics do not have an arm or therefore still require a human task for such as opening the door, picking up the items. So what it will, so these for delivering the medical equipments, all this, the one arm will be there, one arm will not be there, only the some of the support has been done by the humans. These robots also do not significantly interact with the clinical staff. AI system, AI tool in health setting outside the hospital and clinic. So by follow up the caring of the patients, the healthcare ecosystem is witnessing a surge of artificial intelligence driven technologies and products that potentially augment the care delivery outside of the hospital and the clinic settings. So AI driven system, what it will do, the product, it will have the ability to augment or integrate the care outside of the hospitals by placing the chaos key, by testing the all this, giving the extra follow-up care, all those things. These tools can be conducted remote monitoring, support telehealth visits, and or target high risk populations for more intensive healthcare interventions. Artificial intelligence in healthcare setting outside the hospital and clinic, either by telehealth or remote monitoring. Telehealth and AI. Telehealth has been the long standing element of the healthcare delivery system, but not until the COVID-19 has been considered the vital to sustain the connection between the patient and the provider. AI triaging for the telehealth uses the conversational agents enabled in a virtual or phone visit by gratifying the patient based on the acuity level and direct them according to the most appropriate care settings. So telehealth, long-standing element of healthcare delivery system, but not until the COVID. After COVID, the telehealth has been emerging and more vital. So through phones, they can get the consultation during the COVID times and getting the medicine, and thereby they will get the treatments. So AI triage in the telehealth So it is a conversational agents. So by in a virtual, so it triage triaging will be little bit challenging, but when we have the AI in a defined and a computer based and the robotic, all those things integrated and augmented process, so thereby this also triaging also possible. Then by reducing the risk of patient exposure, so they no need to come to the hospital, the risk will be, the hospital required infection will be reduced. And AI triaging platform has been especially advanced during the COVID-19. Advantages in COVID-19: the number of the healthcare system retaining clinic, payers have implemented them to continue facilitation for the care service and identify the possible COVID cases. So in the COVID, during the COVID time, so this telehealth and the AI integration assessment or assisting will be very useful. So they conducted a study, the coronavirus self-checker interactive clinical assessment tool will assess the individual age 13 or other older persons and parents and caregiver and ages 2 to 12 on deciding whether to seek the test or medical care if they suspect they or some they know the contracted COVID-19 or has come to close contact with someone who is COVID-19. So this and that particular mobile friendly tool asks the serious questions. So you already know that AYUL Sedu app. So that is the one of the example for AI utilization in COVID-19. Remote technology monitoring for promoting cardiac health. Wearable and remote monitoring technology can be assisted, ushering in the next era. So it will be in the next future platform in the healthcare data by capturing the physiological data by the AI. So they can able to check whether the patient will be going for cardiac arrest or any cardiac changes. The wearable can be capture the data of any location and transmit back to the hospital. So wearable either, now that is the example for the smart watches. In future it will be enabled by the hospitals. They will give providing the smart watches with the chip. So thereby it can able to monitor the follow-up care of the patients. So these measurement can be coupled with the machine learning algorithms where they will user will be interference and data will be converted and analyzed and the information relate to the health related behavior and physiological condition of the particular patients. Same, the wearable technology can be applied in the many healthcare domains, not only for the cardiac or mental health, other particular of the domains can be helpful. The prominent example of technologies are those that incorporate the cardiac monitor such as heart rate, rhythm sensors including Apple Watch. So nowadays smart watches will be come under the all these things are featured in that. These devices are quite popular, and in case of Apple or device they have the FDA approval, that is in the US, to detect and alert the individuals if there is any irregular heart rhythm, particularly the persons who are utilizing the Apple Watch. So that helpful to detect the irregular heart rhythm and alert the individuals. Then the AI effort in the public and environmental in India. So I already mentioned that we have the AYUL Sedu app in COVID times. So this is the mobile app developed by the Indian government for the people of India to catch the corona infections. So everyone will be undergone with this AYUL Sedu app during the COVID times. AI application in nursing. Nurses impact every facet of the patient care, from the cost of the care to the overall patient experience. In every stages in the patient care, the nursing have the phases. They are the key roles. So in every stage in the patient care, will also include the nursing impact. Within the spectrum of responsibility lies the prospect for a number of different technologies using the computer power of AI to assist within the nursing care. So here the one of the study. So nursing and rehabilitation care of the elderly by using humanoid robots. So the conclusion of this study, they have the positive effects, that is observable effect, including the positive changes in the relationship of patients. Humanoid and the healthcare provide a better outcome in terms of care, satisfying among the healthcare reduces the hospital stay. Some ethical concern, the human person safety or critical factors of the care. Limitations. What are the limitations for implications of AI in the healthcare system? Cost, incur development and maintenance and repair. The cost will be more when comparable. The next one, the lack of human touch. So if the AI are enabled in the healthcare system, so the human touch will not be there, so that will be lack. The next one, lack of own creativity. So what it means there will be a particular scheduled program, so implementing that particular algorithm the AI can be do. Apart from that, it won't have the creativity. Then lack of common sense. Abilities of human may diminish. So human abilities will be diminished when the AI take part in the healthcare system. Robotic superseding humans, then human may become the dependent on machine. So that will be the future challenges. All the human beings will be dependent on the machines. Wrong and cause destruction. If it goes to the wrong hands, the robots, it will leads to the destructions. So now we will move on to the last part of this presentation, conclusion. Artificial intelligence in healthcare is overarching terms used to describe the use of machine learning algorithms and software or artificial intelligence to mimic the human cognition in analysis, presentation and comprehension of the complex medical and healthcare data. So what it will do, it will mimic the human cognition. So human thinking, decision making, problem solving, it will mimic, and it will helpful in the analyzing, presentation, comprehension of complex medical and healthcare data. The next one, primary aim of the healthcare related AI application is to analyze the relationship between the prevention and treatment. So what is the main? It will able to prevent and also the treatment techniques. So this both techniques leads to the patient outcome. Then AI program applied to practice such as diagnose, treatment, protocol development, drug development, personalized medicine and patient monitoring and care. So how we can apply? We can apply in diagnosing the disease, treatmenting the disease, protocol in development and drug development. So whether they increase the dosage or they will go for the other alternative treatments, or next one is personalized medicine for that particular individuals and patient monitoring and care. AI algorithm can also be used to analyze large amount of data through health by electronics for disease prevention and diagnosis. So the AI algorithm is used to analyze large amount of data through electronic health records for the disease prevention and diagnosis. Can AI replace a human being? That is the most $1 million question. AI cannot able to replace the human beings because human beings can create the wonders through AI. So these are the reference, so which helpful for this presentation, and that's the end of this presentation. So far we have discussed about what is the definition of AI, outline, stages of artificial intelligence and the implications of AI in healthcare, and what are the limitations of AI in healthcare system. So these are the things we have discussed. Thank you for your patience and giving an opportunity. Thank you. Good morning, everyone.